since I feel like, we're talking to our participants who are on and can hear us. So, hello, everyone. And we're, I think, waiting for one more person, but we should be able to move forward, Del. Let's do it, since we're a little late getting started. How about that?
I think that sounds great. Well, welcome everybody, and hopefully the last 13 minutes that we gave you graciously were productive 13 minutes. And I apologize for some of the technical difficulties. This is our first virtual meeting of this program year, and so we'll hopefully get these worked out for the subsequent meetings. But good afternoon and happy December. I can't believe we're already in December. I hope everybody had a wonderful Thanksgiving and were able to spend quality time with your friends and with family. So welcome to the Chamber's Business Beat Speaker Series. I am Del Esparza. I'm the president and CEO of Esparza Digital and Advertising and the current board chair for the Greater Albuquerque Chamber of Commerce. So thank you for joining our virtual event today. This is the first, like I said earlier, Business Beat event of the program year. These kind of events allow for the business community to hear directly from high-level experts and decision makers on timely and relevant topics. Today's beat number one, and we're talking about New Mexico's finances and the economy. Very timely as we head into what's going to be a very important, very busy 60-day legislative session that will start next month. As we go into the session, our state budget continues to break new ground, now $10 billion plus, with still billions more in surplus projected ahead. Oil and gas prices and production remain high, driving growth across the state's revenue streams, but we know that will not last forever. So meanwhile, small businesses, which make up the majority of businesses in New Mexico, continue their COVID and recession recovery. So finding qualified workers for employers remain a challenge. Student achievement data suggests that continued problems in our education system, which affects both workforce development and the ability to recruit new companies and skilled professionals to our state. And it's far too easy to find somebody in your circle who has been hurt by property and violent crimes. Three big issues, and three issues that the Chamber is steadfast committed to getting addressed. Come January, our governor, our Senate, and our House will once again have a real opportunity to make spending decisions that could be transformational for our state in the three areas that I just referenced. But it will be essential that we lay out what changes are needed and why, and how we can make these billions of dollars count now and for the future generation. How can we ensure that these year after year windfalls are put in place and will solve some of our biggest challenges? We are thankful today to have LFC Director and State Budget Expert Charles Sallee back with us to give us his perspective on these and any other questions that we might have. But before we get started, I'd like to recognize some great companies and organizations who are sponsoring today's event. They are, and I believe you'll see them on the screen as well, New Mexico Mutual, President and CEO Kelly Mixon, PNM Resources, President and COO Don Terry, Bernalillo County Manager Cindy Chavez, the University of New Mexico and its President Garnett Stokes, including UNM Health Science Center, UNM Health, UNM Comprehensive Cancer Center, UNM Athletics, and UNM Rainforest Innovations. The City of Albuquerque Mayor Tim Keller. Albuquerque Public School Superintendent Gabriela Blakey. Blue Cross Blue Shield of New Mexico President Janice Torres. Central New Mexico Community College President Tracy Haltzer. Central New Mexico Molina Health Care Plan President Carolyn Ingram. French Funeral and Cremations President and CEO Tom Antrim, Excellent Schools New Mexico Executive Director Scott Hidman, Albertsons and Market Street Regional Vice President Carlos Hernandez, Bohannon Houston President and CEO Bruce Stidworthy, Fidelity Investments Vice President of Public Affairs Leanne Kravitz, Geltmore CEO Paul Silverman, Comcast Vice President Chris Duncanson, New Mexico Gas Company President Ryan Schell, James Corporation President and CEO Shad James, and Presbyterian Healthcare Services President Lauren Madigan. Thank you to these great sponsors and for their engagement and generosity. We appreciate each of you. Now let's welcome Chamber President and CEO Terry Cole to introduce the featured speaker for today. Terry?
Wonderful. Hello there. Thank you, Dell. And I agree with everything you said in your opening. From a budget standpoint, especially as many in the private sector are still struggling to get back to pre-pandemic staffing and production levels, I don't imagine anyone could have ever predicted we'd have a state budget over 10 billion, with billions in revenue growth, all still ahead. And I echo your point, Dell, the business community, and in fact, all residents are really counting on the state to set the right priorities and make changes we've needed to make for quite some time on everything from taxes and infrastructure to public education, public safety, and workforce development. It's not to say the state hasn't focused on our challenges, but most would agree that we need to do more, dig deeper, think bigger to accelerate solutions to those changes. Let me check right now, Dell. Did Lauren Madigan make it? All right, then I'll move in to introduce our keynote speaker today. And Lauren, if you're listening, we miss you and we're sorry for the technical difficulties. And we appreciate Presbyterian Healthcare Services interest and participation. So on behalf of the legislature, Charles oversees the construction of the budget, keeps legislators apprised of fiscal and economic developments in the state, and leads a staff of program evaluators who analyze the effectiveness of various programs in state government. Charles is in his second year of leading the LFC. He previously served as the LFC's deputy director for 12 years and also as a program evaluator in the Roundhouse for 5 years. Some of his work has led to major policy changes or cost savings in the areas of Medicaid, higher education, adult and juvenile corrections, public schools, and workers' compensation. Charles grew up in New Mexico and earned a BSW from New Mexico State University and MSW administration from Texas State University, San Marcos. After Charles presents, he'll take some questions from our board and from many of you. During his presentation, if you'd like to pose a question, please just type it in the Q&A box on your screen, and we'll try to get to you as many as we can. So welcome, Charles. The floor is yours.
Great, Terry. Thanks so much for having me today. So I'm going to talk a little bit about where we're at with our state finances, if I could get my slides up. A lot of this revenue growth, which is unprecedented that we've seen, that's it. If we could advance to. Is really been driven by the energy sector and coming out of COVID, actually a pretty strong economy as well. I think of our revenues that come into the general fund in three big buckets. The first is our general economic health. That can drive part of our gross receipts, personal income taxes, and the like, health insurance premiums. The second are our investment income. That's money from our permanent funds that comes back into the general fund. And the third are direct and even indirect energy revenues. And so one of the things I want to leave you with today is that this rapid increase in revenue increases, we've done a couple of different things. One, we've taken peak revenue gains in the energy sector, and we've set those aside as a part of a series of fiscal policy changes dating back to the latest oil bust in 2016, when we created a true rainy day fund, then we created the Early Childhood Trust Fund, and now we're putting energy revenues back into the Severance Tax Permanent Fund. The second,
Charles,
is,
real quick,
yes.
I don't mean to interrupt you, but I'm not sure if you're showing slides or not, but they're not showing
I can
up.
see them.
Yeah. Okay.
If we could back up one. Can other people see it? I can see it on mine.
I'm not able to see it on mine. I'm not sure, Deval, if you're able to see it, or Terry.
I'm able to see it on mine.
Yes,
Okay, good. Okay,
I can
great.
see it too.
Good, perfect.
Okay. So the second big, so that's energy revenues, and through a series of fiscal policy changes, how we've tried to deal with those, and the extraordinary growth we're still seeing within our general fund revenues. The general economic health of our state, most of that growth and strength that we've taken has been pushed back out into the economy through a series of tax cuts. So not much growth coming from that sector anymore. And then the investment income is our strongest, most stable growing revenue stream. We could advance to the next slide. So normally I would show this graph going back to right before the Great Recession, and I would say we could run this roller coaster of general fund volatility all the way back decades. And we went ahead and did that to the mid 1960s. So you can get on our website and see how much money we were generating in gross receipts taxes in 1972 versus what we're projecting for next year. But you see that incredible volatility of the black line, the up and down, that creates real challenges for strategic budgeting. So those series of efforts to sort of take out the peaks from energy revenues and put those into investment income funds is really going to be a nice stabilizing mechanism over the mid and to the long term. But you can also see on the far right part of this graph that the extraordinary revenue growth that we saw coming out of FY16 is over. So basically, we've had a huge run, and now revenues are plateauing. In fact, they will be down slightly this current fiscal year, and then growing ever so slowly at about 2.8 to 3.2% for the midterm and even the long term. Next slide. What does that mean? Well, the good thing is with this entire run-up, the legislature hasn't been trying to spend the recurring budget to equal the recurring revenue. They've left a cushion each year. And that cushion has been used for unprecedentedly large non-recurring spending items. It's been used to cash finance capital. It's been used to endow other permanent funds like the Higher Education Permanent Fund. And what I tell members is virtually everything is affordable right now because of this sizable gap. But the question is, how fast and at what point, what date, fiscal year, do you want to build a budget that's only growing 3.2 or 3%? That's about 1% less than we had in the good years under the Martinez administration. And the fact is, building a 3% budget means we're cutting most state agencies. Schools will get their share. Medicaid will crowd everybody else out. Under good economic circumstances where we're having to pay more of our share of Medicaid costs to the federal government, and because of enrollment policies of wanting to cover lots of people, those normally during good economic times, the Medicaid rolls would shrink. They would not shrink as much to be able to fit within that level of budget. And everybody else would need to have their budgets adjusted accordingly. So that's what happens if we spend at the levels we were spending over 2 and 3 fiscal years ago, and why we've been advising the legislature to start reining in the rate of spending growth, bringing that back down from about 14% a year to a more sustainable and healthy rate between 4 to 6%. And so now that we've got enough breathing room the past couple of years to do actual long-term budgeting and long-term revenue forecasting, it's telling us that we've done a great job of setting aside money for the long term in these permanent funds. We've had a huge run-up that you'll see in a couple of slides on the operating budget, taking care of a lot of today's needs. You know, the agency requests that came in didn't have a lot of creativity for needing to do new programming or solve problems. It was just feeding the bureaucracy in many ways and paying people a lot more or hiring people to do the same job. So not a lot of need on the near-term operating budget, but a real need for midterm financing strategies. And the newest strategy here is we can afford to ease into, let's say a 5% budget growth if we can assume that that's going to happen year over year for the next 5 years. You can accommodate kind of your health insurance cost increases. You can accommodate your ability to keep pace for being a competitive employer. You can afford base costs within Medicaid and even maybe a little bit more. What you can't really afford are a bunch of new initiatives for different things that government might need to be trying to get different results. You can afford to do a lot of things within the K-12 budget. And so the legislature created the Government Results and Opportunity Fund. It's called the GROW. You'll hear some member level GROW that used to be called Junior came out of this same fund, but the bulk of it is setting money aside for the midterm to test out on innovative pilot projects. Don't get money into the base budget for Child Protective Services until you're sure that that strategy is going to work. We'll prioritize spending through those pilots on things that research suggests are going to give us better results, but we want to see how they work in the real world and how agencies are able to implement those before recommending bringing them into the base budget. So adding a significant amount of budget discipline, using some of that surplus and spreading it out over the next 5 years. Next slide. And you can see budget growth dating back to FY19 by percentage wise. Some of these had a low base. So, the investments in commerce and energy and natural resources look really steep. Dollar wise, it's not so much. The big one that really jumps out is the big growth in spending, both from the general fund as well as other revenue sources for health and human services. That's where the Medicaid budget is. Overall growth of about 61% since FY19 from the general fund. Next slide. One more. So our state fiscal outlook. So we've got an opportunity where revenues have been soaring but are tapering off. How do we use this unique opportunity in history to make sure that the investments pay off economically down the long term? The committee's budget priorities fall into 3 large buckets. The first is to diversify our economy and to make sure that we can afford this level of government spending in the future, as well as provide a nice place to live for people, is we have to dramatically increase the number of individuals and their personal per capita earned income. The only way that I know to do that is through much higher levels of educational attainment. And by that, I mean everything from trades to associate's degrees, primarily bachelor's degrees, but even advanced degrees, is the way that we become a more prosperous society. And you do that through work. And it just so happens that we've got plenty of work to do and not enough workers to do it. So there's definitely a skill gap that's hampering and probably holding back our economy coming out of COVID. The good news is the employment levels rebounded very quickly. Unemployment is low. Federal funds rates are projected to come low as it looks like we've hit the soft landing. But our labor force participation is too low, primarily because of that educational employment gap. Next slide. So total non-farm employment has rebounded above pre-pandemic levels. And if you recall the lost decade coming out of the Great Recession, it took more than 10 years to recover to pre-recession employment levels. Our unemployment remains small, but again, both of these continue to be hampered by New Mexico's low labor force participation rate. And in large ways, very high numbers of underemployed individuals when you consider that a lot of your businesses are paying wages on an hourly basis that should lift people out of poverty, even for families of four. But it doesn't seem as enough people are in those full-time positions or working full-time if they have the opportunity for our poverty levels to be dramatically lower than what they are today. Next slide. So the first kind of budget priority was those things that are going to get improve our personal per capita earned income. The second would be to dramatically improve access to healthcare. That includes behavioral health care as well. And the third are investments to improve New Mexicans' quality of life. That can be everything from safe neighborhoods, clean drinking water, even nice amenities like recreation centers, rodeo centers, parks. You know, the legislature set aside 90 million over 2 years for regional recreation and quality of life grants for local governments. And there were some pretty neat projects that were a real success story that came out of those appropriations, including, as just an example, Deming built a lake and a water play park for kids and families at that lake. So historically, a retirement-oriented community is able to shift to have nice amenities for growing families. How are they able to do that? This dramatic rise in oil production is driving everything. Those peaks and valleys that I showed you in the graph going back to the 1960s were largely driven by price volatility built into our energy revenues. What we've been experiencing since 2016 is a production boom. Very different, and why we feel comfortable that production boom is likely to remain into the 2030s, according to industry experts. There's some divergent outlooks that energy output may peak in the 2030s with a slow, moderate decline, certainly well above anything we've seen in our lifetimes for years to come, or plateau. Certainly, with the most recent election, these may change to more of a consensus around plateauing. But we'll see. It's not for lack of oil in the ground down in southeast New Mexico. But the legislature has taken some of these peaks and they've chopped them off and they put them into the severance tax permanent fund so that in less than a decade from now, if those revenues start to taper off, if production starts to taper off, the investment income is expected to replace it dollar for dollar. The problem with that is that's flat revenue growth. That's not even 3%. So we've got a lot of headwinds facing us for the next generation on being able to grow revenues at a more sustainable level to support the level of government that people have enjoyed in this state, or make changes to the level of government spending that they want. Next slide. So, like I said at the outset, the other nice thing about this strategy has been how much it is insulating the general fund from that volatility. This is a good graph where you can see in FY23, in the past, before we created the Early Childhood Trust Fund, all of that energy revenue would have been coming into the general fund. One, we would have had massive spikes to the amount of available recurring spending that we couldn't possibly spend responsibly, to be honest with you. It's just not enough. There's capacity constraints to getting money out the door in an effective way that gives us good results. But you can see that peak in 23 and then a dramatic decline. That would have been reintroducing that budget roller coaster that we saw in the earlier slides. But when those revenues didn't come in, the general fund didn't feel it at all. And in fact, if you looked back at last year's August and December revenue estimates in the out years, you would see a dramatic revision downward of the amount of revenue they expected to come in to the state from oil and gas. It just so happened it reduced how much was going in to those different permanent funds, and the general fund revenue estimate stayed virtually the same, even though there was a big change in the oil outlook. Next slide. This is a cool diagram that we came up with this year because the amount of contribution from the oil and gas industry into our government sector totals about 15.3 billion, the vast majority of which is going to go to the state, but also local governments benefit to the tune of about $1 billion, and the federal government extracts its share of about 2.7 billion just in a single year. And where does all of that money go? It goes into the general fund, the majority of which is funding education, including higher education, and our healthcare system. It's supporting huge outlays for capital outlay opportunities. A big portion of it is going into our investment funds that produce a significant return over time back to the general fund and back to public schools. So this has grown significantly, and it has resulted in real opportunities for the state to try to turn the corner and not be 50th in everything. Next slide. So we've been trying to balance kind of the near term with 61% spending increases in the operating budget. We've done a lot of long-term spending and saving strategies. And now we've created the midterm financial strategies of you got to prove that it works before it gets into the base budget, because we want results to be different in the future. So we have to make these investments count. They need to result in transformational impacts on New Mexico into the future for us to be able to afford this level of spending, but more importantly, for the lives of New Mexicans. We need to continue to resist spending all of this recurring surplus. We should use some of this surplus for non-recurring uses. We can afford to not go into debt for capital. We have to make sure those capital investments actually result in something more and better, not just paying more for what we were otherwise going to do. And then, like I said, setting aside some of the surplus for the grow to make sure that those new interventions that we're trying are more accountable back to the people, that we can demonstrate that they are in fact working and deserve to be an ongoing recurring expense in the base budget. And if they can't, then we're going to need to have discipline as a state not to build it into the operating budget. That's the whole point of this test ground, not to just automatically build something in that doesn't work, but actually sunset it. Next slide. With that, I'd be happy to answer any questions.
Wow, great presentation. Gee whiz, I guess what a great problem to have, but it is something that we certainly need to be aware of and address methodically as a state. So thank you for your insight, Charles. That was a great presentation. So if you do have a question, please go ahead and put it in the Q&A on your screen, and we'll try to get to as many questions as we possibly can. First question, though, is going to come from Janice Torres from Blue Cross Blue Shield of New Mexico. Charles or Janice?
Thank you, Dale. Hi, Charles. Good to see you virtually, and great presentation. As you know, I'm integrally involved in healthcare in our state, and our leaders have made some big investments in our healthcare workforce in the last few years, including reimbursement rates, nursing slots in our colleges, and loan repayment plans. But we really still don't have enough providers, and access to care continues to be a challenge. Given the debate over the medical malpractice coverage, and with many of these professionals retiring, leaving, or simply what I hear, skipping New Mexico, all while some lawmakers are pushing now for Medicaid forward to cover more patients and expand Medicaid even further, how can we as a state invest so coverage just isn't an empty promise?
Right. And we've talked for the past couple of years in LFC about the fact that we spent a lot of time as a state really focused on expanding coverage, when in fact we should have been spending more time not only focusing on expanding coverage, but access to high quality care. Because if you have coverage, but you have no doctor that can see you in 6 months, the effect of that coverage is really diminished significantly. So, and this comes down to an all of the above kind of recruitment retention. One, there's investments that have been made to increase the pipeline. You mentioned the endowments and the nursing program expansion. Same thing for, the legislature put in enough money to effectively double the degree production for our social work programs. The challenge that we're seeing left and right is on the implementation, where we're not seeing that money being put to use to effectively double the enrollment and the graduation rate for social workers. We're not seeing the investments for startup, for behavioral health startup costs that providers can then expand and bill Medicaid or for child welfare prevention programs. Those resources just aren't being used, or they're not being used as they were intended. So that implementation is really critical. You'll hear time and again us point out that it's not for lack of resources. So part of it too is really having a strategic plan on, well, if we need X, how many doctors do we really need, and geographically where, and what are the best mechanisms to get them from point A to B? And it might be that we're just only able to attract enough to fill the vacancies from the retirements, as you talked about. That's going to be a real challenge going forward if we're going to ever make a dent in access, because this isn't just a New Mexico problem, it's a problem everywhere. So if you're trying to recruit a nurse practitioner who's got opportunities in Texas, Arizona, and Colorado, other things like tax policy, quality of life, schools may edge out us paying 150% of Medicare in our Medicaid program. So I think it's all hands on deck when it comes to provider recruitment and retention.
Great. Great answer. Thank you for that. Charles, we have a couple of questions in the Q&A. I'll just, Gabe Gallegos posed the question. On the issue of GRO, can you elaborate on some examples of pilot projects that have been funded? What are some of those accountability measures and metrics that legislature is evaluating these projects on? Is there a comparable program on like this anywhere in the U.S.?
No, not that I've seen in the U.S., because nobody has the kind of resources to be able to set aside and dedicate towards this. Definitely lots of places around the country that have significant budget discipline around funding evidence-based services in their base budget and prioritizing that, just like New Mexico is a national leader. But this is a good example. Child Protective Services, of all the programs in government you would think we should be throwing money at, that would be one, right? It's on the news every night. Everybody, it tugs at your heartstrings. It's a challenging work for the workers. We've poured money into that program over the last decade. We held it harmless during the oil bust. Still, the results that we're seeing are not what we want. And part of it is because they're not implementing services in people's communities, in people's homes, that research has shown actually helps kids and helps parents be able to effectively raise their kids. So rather than put more money into Child Protective Services base budget, CYFD's budget this year is flat, basically year over year. And you would rightly ask, how in the world can you get away with that politically? And it's because we funded basically almost all of the ask or the need through the GROW. So one example would be they've got 3 years worth of funding to go start up and start implementing evidence-based services like Safe Care, Triple P. There's a number of different differential response. They've got the money to implement those things. And then if they get a plan approved by the federal government, the feds will pay for 3/4 of the ongoing cost. Or Medicaid will pay for that, the 3/4 of the ongoing cost. So significant investment when you include all of those funds over the next 3 years. And they'll be required to do an in-depth program evaluation to show that it's working, that the kids who got the intervention were doing better and needed foster care less than the kids who didn't get it, because we can't scale it up statewide everywhere. They'll need regular performance reporting on the safety of kids, on the effectiveness of parents getting drug treatment as an example. So that's one example of a project that the legislature funded. Another one is a scale up of certification programs at our community colleges and four-year institutions that are industry driven, basically career and technical education. These are short-term certificates that are very business focused to help bridge that skills gap that we talked about earlier on that's holding us back on labor force participation. $20 million a year across the state to be able to pay for those and demonstrate whether it works. And if it works at a level that we all find acceptable, then we'll figure out a way to move it into the base budget and maybe expand it down the line.
Great. Related to healthcare, if I could just touch on healthcare again, Senator Hickey posed a question about, we've been able to increase rates for primary care and for behavioral health. What about specialists and increasing those rates for specialists in an effort to probably recruit and certainly retain those much needed specialists?
Only other ones might be in the infant and maternal suite of services. But definitely there was a priority for primary care, infant and maternal care, since Medicaid's paying for 80 to 85% of the births, and for behavioral health care. Other rate increases for all of the other types of providers have not been moved up to what will be 150% of Medicare. They've been moved up at least even with Medicare, and then we're keeping up with Medicare's inflation going forward. So that's something definitely we should be taking a look at. What is their book of business and how much can Medicaid help move the needle on a recruitment and retention? And did this strategy that we already tried actually help or not?
Right. I have a question, just because so much of your presentation revolved around oil and gas and revenue increasing really for the past several years, and just how it's been such a strong economic driver for our state and mitigated some of the impacts that that COVID had. The other states just didn't have that buffer. What would you say is the biggest threat to the oil and gas industry right now? And given that they are finite resources per your presentation, is there another bright spot in our economic outlook that we can look to for potential diversification?
Sure. So oil is big when it comes to its sizable impact on our GDP, certainly, and our state revenues. From an employment standpoint, not as big as other sectors of our economy. When over the past 15 years, they become, those drilling rigs in particular are very, very efficient, and they bring out a lot of oil from each rig. Now they deplete really fast, so they have to constantly keep drilling. The thing that is a risk to the oil forecast to me in the near term is if somehow there are geopolitical events that allow a lot of Russian oil to come back out of the black market into the regular market and have the effect of dramatically reducing prices. They'd have to go really low to affect probably drilling activity in the Permian because it's so profitable. But I would say that that's a near-term geopolitical thing that I'm concerned about. We're drilling the most ever on federal land. So federal policy towards this industry and drilling will be favorable, at least for the next 4 years. But that could also go the opposite direction in the midterm. And we would be exposed to those kinds of things. We could also do something, as a state to make it less economical for those drilling activities. And that has been a concern of some members of the legislature, but there's flip side of also concerns of for the broader environment and the health of people that are living down in Southeast New Mexico in particular.
Mm-hmm. Great. Harry, I don't know if you wanted to ask a question on education.
I do want to talk about education if we have enough time, but I wanted to flip back to something else, Charles, you said earlier. You know, you and I have worked together for a lot of years, and what I have always appreciated about you is how pragmatic you are and how you approach this budgeting process and finance process with sensibility and what's realistic and what's not. And you and I share the same pet peeve over all these years that both of us have made public at one time or another. And it is that in New Mexico, we tend to keep funding things that don't work and that aren't effective and that get funding anyway, over and over and over again. So earlier in this conversation, when you talked about the initiative of the pilot program that really will begin to force a solution in that regard, that pilot money can be authorized, but if the results aren't there, we're not going to keep funding it. So I think that if you, as the LFC director, if you can really provide the kind of leadership that makes this a reality, it will be your legacy in New Mexico, and it will make a world of difference. I remember, especially during the lean years, when we were spending so much money that we didn't really have on things that obviously were not working, was so frustrating to you at the time, to me, and to many other people. So I wanted to commend you, first of all, for providing the leadership to tackle this. It's going to be pretty hard. And to get inside your brain a bit about how you're going to really make this work and what kind of help you need and from whom.
Well, I think, you know, this strategy of not just automatically funding everything, hopefully the business community will be supportive of making sure that their tax dollars are effectively used to get better results in their communities. You know, so I think that's the first thing. The second, for us to, this is a challenge for agencies because they're not used to having the capacity to do evaluation work. So we need to figure out how to bring evaluation capacity to our state in a much greater level. I've been pretty clear with the agencies that I don't want to see an evaluation 3 years from now on something where somebody gets a free government service and they ask them, did you like that? And of course they're going to say yes. We want to know, was it effective compared to the counterfactual, you know, rigorous evaluation. And we want accountability metrics along the way so that we're not waiting to be surprised 3 years from now. So that means they got to start now. So that's something that I don't have an expectation that the business community, you know, help solve, but certainly we need to at least call for it and then we have to respond. So those are two really key things. We've launched, along with DFA and SPO, capacity building, like free training for state employees on how to do evidence-based budgeting and policymaking. The legislative branch is far out ahead of the executive branch in this particular area. That's led to some level of frustration that we're not seeing that really incorporated into how government's doing business. But that should just be a foundational expectation of the business community and others for how government should operate. Look at the Medicaid report card and tell me if that tells you, as the business community, what you're getting for that amount of money. And I will venture to guess it's not going to be good.
Well, I think it's a wonderful challenge. Del, I would ask you to comment on it as well, but that's a great challenge to us. And, you know, we'll take on that challenge, right, Del?
Absolutely. You know, anytime we're able to, it's, you know, at the end of the day, it's about what kind of return we're getting on this, you know, this precious investment that we're making as a taxpayer. And so anything that the chamber can do, anything that we can do to help support that and foster that kind of accountability is only gonna make funding future initiatives that much easier.
And
good example of that would be for like Child Protective Services. We actually do cost benefit analysis on these evidence-based interventions. And we can show you graphs that we've been producing for like 10 years of like huge returns on just a handful of these. And it's like other people besides us nattering at the elected officials should be saying, why aren't you funding these over here on the left that are producing like $3 to $8 return on investment? Why are we tolerating investing our dollars in things that we either know don't work or clearly don't work? I mean, how is that tolerable? Not to mention the fact that, you know, the people that are participating in them aren't better off.
Absolutely. Del, that takes me to education if you want me to
Sure.
ask that question of Charles. And you know, Charles, I'll stay along this same line of conversation because it applies to everything. Healthcare, and Janice might want to weigh in here in a bit on the healthcare piece, but on education, that's a place that we really should be funding only evidence-based programs, particularly with the Yazzie Martinez court order. How can we apply what you're trying to do to education?
Well, certainly there's been pretty strong and consistent efforts for targeted interventions that have good research behind it. I'll give like teaching the science of reading is a good example where we're pretty close to scaling that up in terms of coverage for training teachers to teach it correctly. I think a lot of outstanding questions that we need to continue having about whether the teachers are actually incorporating that new training and teaching into their classrooms. We're doing a project right now where we're taking a group of high poverty, high performing schools, like 80% proficient, and high poverty, low performing schools, and going in and doing a deep organizational assessment, deep dive. What are the ones that are performing doing? What are the ones who aren't performing doing? And we consistently see some pretty common organizational features when we've done this in the past. The first one is something that doesn't cost any money, and that's that the organization and all of the adults in the building have high expectations for every kid that walked through that door, regardless of the circumstances that at home. The next is they've got really strong principal leadership. That's an area I think we need to figure out as a society how to develop that leadership talent at the principal level and allow them to stay in that position and thrive for a career, not feel like they need to move on to the central office level or get burned out because central office is constantly piling on them. When we see those two things, along with the organization is very data-driven, and because they've got that good leadership, everybody's rowing in the same direction as an organization. So all the curriculum is aligned, everybody's moving in the same direction, and you usually see, even in very challenging schools with populations of lots of kids from low-income families or even Native American families, achieving at very, very high levels. How you do that at scale for 300,000 students and hundreds of schools that's really our challenge. But the cool thing is we're not very big. And to get to like the national average for like high school graduation rate, we need to graduate about 2,200 more students on time. And when you start breaking that down by school, it's like Santa Fe High. Why can't you graduate 40 more kids on time? Don't just pass them through, but make sure they're prepared for a career in college. But why is 40 insurmountable? And if Santa Fe High can do 40, why can't Capital do 30? Why can't Pecos do 6? But I think we have to have that consistent leadership to challenge all of these complicated school systems on very realistic targets, and then give them kind of the roadmap on how to get there. And we've obviously not had that in part due to the pandemic, but the leadership turnover at PED has not been helpful to have that kind of consistent thing. Everybody talks about Mississippi now. Mississippi's had consistent leadership. There's no silver bullets in any of this.
You know, speaking of Mississippi, putting a plug in there, Dell, and I know Charles would appreciate this too. We have the superintendent coming in May of next year to talk about how she did that in Mississippi. So we're right with you on that 100%. And you know, one of the most important things she did was to make sure every child could read before they went from 3rd grade to 4th grade. But she did it with a lot of empathy, training, support, and help. But nevertheless, there was no child in Mississippi that went from the 3rd grade to the 4th grade who were not rating grade level. So, you know,
extraordinary investments and interventions leading up to that milestone test.
right.
So it wasn't like the test itself and the accountability metrics that came with it, they could flip a switch. There was a lot of work with interventions before that. And we're doing the same thing. I mean, they don't have full day, almost full year pre-K for 3 and 4-year-olds like we do. Our pre-K teachers adequately, you know, playing, you know, to teach kids the ABCs and 1, 2, 3s. You know, there's a large sector of the early childhood community that doesn't believe in doing that. It's just free play is better rather than kind of organized play.
Well, I think you brought the proper term, and that's leadership. You know, and it boils down to leadership, and to Mississippi's case study. It's really consistent leadership and a great visionary leader that we'll be bringing in the spring, as Terry referenced. Just as a quick check-in, it's a little after 4. We started about 13, 14 minutes late. So if it's okay, Charles, we're gonna go for maybe another 8 to 10 minutes if that works for you.
That works.
I do have a question on kind of our infrastructure here in New Mexico, especially with the record surpluses that we've talked about in your presentation. Certainly we're all familiar with. We still have road and bridge maintenance that is still an issue in many of our communities, and drinking water issues. So any thoughts on how we could finally prioritize infrastructure spending in our state?
I think we've actually been doing a pretty good job on the heavy maintenance of our highways. There's spots that everybody can point to that are a challenge, and it's not going to happen overnight. It hasn't happened overnight. But if you think about like the last 20 years, virtually all the interchanges and bridges have been rebuilt within the greater Albuquerque area. You've got 6-lane freeways from Bernalillo to Isleta. We've not had major investments for things that may spur economic development, like, Phoenix is building loop after loop around their city. We've not gotten to that. We're just not set up or equipped to do it with the way that we build that infrastructure. The successful water projects that get done when communities get help with the capacity to navigate all the different programs that exist to help put those systems into place, as opposed to trying to go to their individual legislator who doesn't have enough money within their capital program in order to be able to even make a dent in those type of projects. So I think you'll see a lot more talk about pumping in extra money into those programs that are getting capital projects done. NMFA has got enough capital projects in its water trust fund program, kind of, for lack of a better term, in the pipeline that their earmark of money won't support. So that's something we're definitely looking at with some of these resources, because we know those projects are vetted. We know they've got the technical capacity to do them, and they just need the resources to get them done. So I see those kinds of big pots of money as helping communities, like the regional and quality of life grants. That came out of nowhere for DFA because it was an LFC rec, and they stood the program up rather quickly. We did an evaluation of its 2 years of spending and found, for the vast majority of entities that got funding, they put it to good use very quickly, really sprucing up a lot of communities all across the state. So looking for opportunities where we can get those kinds of wins for infrastructure projects to get upgraded. The other thing is continuing to incentivize regionalizing all these small water systems, if not nothing else for the operations of them, maybe not interconnecting the pipes, but finding qualified, water operators for that many small systems, which we've got a lot of very small systems, is proving operationally challenging. And then you can't get ahead of the maintenance. You can't get ahead of project planning for capital upgrades. We're loath to take out debt for water in this state for some reason, but we've got tons of capacity to be able to take advantage of very low lending rates for these projects. And part of that is because everybody sees our capital outlay process and wants to go get the free money. Let's be perfectly honest.
Yeah. Terry, I don't know if you have any final questions. If not, I can go to a question in the Q&A.
Yes, I'll make it quick.
Okay.
So the elephant in the room is public safety, and we know there's going to be a tremendous amount of focus on it as we move forward in the session. How do you think on the budgeting and finance side of the question, money will be spent and need to be spent? What are your thoughts?
So it's obviously built into those broad priorities I talked about, safe neighborhoods. It's a complicated system with lots of independent actors, not all under the umbrella of the state. So think about what has to happen. You have to have a police department that's effective at not only policing to prevent crime from happening, but from catching the bad guys and then turning over a good case to an independently elected DA that has to have enough competent attorneys to be able to effectively prosecute that case against an effective public defender department who's independent. You've got the judicial branch that's going to judge, make sure everybody follows the rules. And if they do, then you've got the state comes into play when the person's sent to prison. And that they have a role to play to make sure that they come out better off than they went in, so they don't go back out and do the same thing. And we'll have a new report on this next week on reentry. And what we found in the past is that the vast majority of the revolving door is due to behavioral health and substance abuse disorder. There's definitely violent criminals in there, but violent crime tends to be preceded by a lot of low-level crime that we can see in a lot of the cases. And the system has a huge accountability gap where arrest clearance rates are down, arrests down, successful prosecutions down, and the people that are roaming through the system like 4 or more times, the reason they're able to do that and be out on the street is because of evidence collection and the inability to get witnesses to help make a strong case to send them to prison if that's what they need to do. And usually the people that are touching the system haven't identified behavioral health or substance abuse disorder issue that's not being nipped in the bud early on. It's just being allowed to fester and get worse until the point that they, first they broke into your car, then they broke into your neighbor's car who had a concealed weapon that they left in there. Now they've got a gun. Then they're charged, then they get into like an armed robbery situation and maybe get away with it. And then somebody puts up a fight and gets shot. At that point, the system takes those individuals out pretty quickly. But leading up to that, over the 2-year period of terrorizing our neighborhoods, the system is largely ignoring the underlying problem. And so that's what we're seeing, and that's very difficult, but it will be a priority coming out of LFC, and I'm sure the full legislature, as well as the executive branch. But lots of different actors have to get rowing in the same direction. And we've got, in my view, too much finger pointing at the local level and less rowing in the same direction to make sure that we make our streets safer.
Thank you, Charles. Dell, that's a good segue into the question we've got.
Yeah. So real quick. So if the question that we have in the Q&A is, addictions drive a great deal of crime. The state and local communities are just now starting to roll out treatment and recovery programs with the opioid settlement funds, and there appears to be statewide prevention programs funded. Where is the leadership and coordination of that?
We don't have it. We don't have a leader of the state's behavioral health collaborative that should be shepherding what are the needs, what are the gaps, what's the plan going forward. We know all the services, and medication-assisted treatment for opioid addiction provides an enormous amount of promise for our communities if we can get people connected with a physician to provide a prescription for it that you can walk down to Walgreens and get. And it literally, the opioid addiction is altering the brain connections and the way that it functions. Mm-hmm. And that's what's driving a lot of those behaviors. And the medication-assisted treatment reverses that. And then combined with counseling to get to the underlying issues, for a lot of people, it would provide a lot of help. There's other more serious people with serious mental illness that need better coordination of a broader array of services that they're not getting today. But, as a business community in Albuquerque, I would be asking, we chose as a community to tax ourselves at a much higher rate in the GRT for both behavioral health and for law enforcement. What do we have to show for it? For behavioral health, you're leaving an enormous amount of money in Washington, D.C. by not working with UNM and leveraging that healthcare system and others to be able to match Medicaid. The vast majority of people that you see on the street corner are probably enrolled in Medicaid and could be getting services funded through that. And then that comes back to the provider and the capacity. And, that's one of the GROW funding strategies, is to expand the number of certified behavioral health centers that provide everything from crisis triage to prevention and outreach to counseling, drug treatment, the full array of best practices, behavioral health services. That money is going to need to be deployed effectively to bring those organizations up to be able to provide those services. We can't have things like Turquoise Lodge at virtually empty because they want to cherry pick the easiest clients to go get, inpatient detox, which doesn't work very well. Right. And that's where we're spending a lot of money right now already.
Well, I think it boils down to demonstrating progress and metrics and accountability for every dollar that's spent. So thank you so much. Oh my gosh, we can go on for hours and hours. You're fantastic, Charles. We really appreciate your time and your energy and your perspective, especially going into that 60-day session. I'm confident we'll be seeing a lot of you up there as the chamber will spend a lot of time up there lobbying for our businesses. So to wrap things up, I'm going to pass it to Janice Torres of Blue Cross Blue Shield for closing comments.
Thank you, Dale. And Charles, thank you. That was an incredibly informative presentation and conversation. I'm sure everyone appreciated the candor and the detail. As a business community, we certainly believe that cash flush state government is a good thing, and certainly better than the alternative, which we've experienced far too many times before. However, when revenues are booming, and especially over a multi-year period, it's tempting for everything to all of a sudden become a priority. We hope that doesn't play out in this coming session, and meaningful changes need to happen. We continue to believe that significant, meaningful tax relief should be a legislative priority, and that our capital spending should be better focused on rebuilding the foundations of our economy and communities. We don't want to look back 20 years from now and say, if we only had spent those infrastructure dollars more wisely, or if we had made New Mexico more tax friendly, or if we had done things to increase access to care and help businesses to grow their jobs back then. And with respect to policy priorities, 3 issues come to mind, and that are absolutely tied to the long-term health of our economy. 1, a shortage of doctors and other healthcare workers, a need for stronger academic performance in our public schools, and crime, specifically a justice system that has made it far too easy to commit crimes and get away with them. Why are these the big three? Because our ability to support and attract businesses and workers is tied to people having real access to healthcare, education, options that deliver for kids and family, and safe homes and streets. This is not too much to ask for, and fortunately, the Chamber, our business community, is committed to partnering with those in power to address these issues over the long haul. We have skin in the game, and we have ideas and perspectives to offer. You know, we live in a wonderful place, but these big challenges have hung around our state for far too long. It's time to push them back, and with focus and, yes, a big surplus, balanced surplus, we can get it done. So on behalf of the Chamber, we would like to once again thank these great sponsors of today's Business Beat event: New Mexico Mutual, P&M Resources, Bernalillo County, the University of New Mexico, the City of Albuquerque, Albuquerque Public Schools, Blue Cross and Blue Shield of New Mexico, Central New Mexico Community College, Molina Healthcare, French Funeral Homes and Cremations, Excellent Schools New Mexico, Albertsons and Market Street, Bohannon Houston, Fidelity Investments, Geltmore, Comcast, New Mexico Gas, James Corporation, and Presbyterian Healthcare. We want to thank everyone for attending today's first installment of the 2024-2025 Business Beats Speaker Series. We've got many more events planned in the coming months, including our DC Fly-In, networking at Fogo de Chao and Electric Playhouse, our legislative session recap luncheon with Governor Michelle Lujan Grisham, and more. Until then, have a safe and happy holiday season. Thank you all very much.